Blackberries are gaining recognition not only for their antioxidant richness and low sugar content, but also for their potential to support cardiovascular health, specifically in the management of cholesterol levels. As elevated LDL cholesterol and low HDL cholesterol remain major risk factors for heart disease, natural dietary strategies that promote a healthier lipid profile are more important than ever. Research increasingly points to blackberries as a valuable tool in this regard, offering both preventive and therapeutic benefits through a combination of fiber, polyphenol, and micronutrients. One of the most compelling components of blackberries in cholesterol regulation is their soluble fiber. This form of fiber binds to bile acids in the digestive tract, which are made from cholesterol. When soluble fiber traps these bile acids and escorts them out of the body through the stool, the liver is forced to use more circulating cholesterol to produce new bile, leading to a reduction in LDL, or bad cholesterol. Even a modest daily intake of soluble fiber has been shown to produce measurable improvements in blood lipid profiles, and blackberries contribute meaningfully to this effect with about 7 to 8 grams of fiber per cup, including a portion that is soluble. But fiber is only part of the story. Blackberries are also rich in anthocyanins, deeply pigmented polyphenol that offer far-reaching cardiovascular benefits. Anthocyanins have been shown in both animal and human studies to help lower LDL cholesterol while increasing HDL, or good, cholesterol. These compounds work in part by reducing oxidative stress, which is crucial because oxidized LDL is far more damaging to blood vessels than unoxidized LDL. By neutralizing free radicals and reducing lipid peroxidation, the anthocyanins in blackberries help keep cholesterol particles from turning into artery-clogging plaques. Additionally, anthocyanins appear to influence key genes and enzymes involved in lipid metabolism. They may downregulate HMG-CoA reductase, the same enzyme targeted by statin drugs, and upregulate the expression of receptors that help clear LDL from the bloodstream. Though the effects are not as dramatic as pharmaceutical interventions, they are natural, cumulative, and free of the muscle pain, liver stress, and other side effects sometimes associated with cholesterol-lowering medications. Blackberries also contain trace minerals such as magnesium and manganese, both of which play supportive roles in cardiovascular function and lipid balance. Magnesium, in particular, helps regulate blood pressure and may improve HDL function, while manganese supports antioxidant enzyme systems that protect blood vessels from inflammation and damage. Some clinical trials involving berry-rich diets, including those with blackberries specifically, have shown modest but consistent reductions in total cholesterol, LDL levels, and inflammatory markers such as C-reactive protein, CRP, which are closely linked to cardiovascular risk. These effects seem to be most pronounced when berries are consumed regularly over a period of weeks to months, reinforcing the importance of consistency in dietary patterns. However, while blackberries are safe and beneficial, relying on them alone without addressing broader dietary issues, such as high saturated fat intake, excessive sugar, or lack of exercise, will not be enough to improve cholesterol on its own. Blackberries should be seen as part of a heart-conscious dietary strategy that includes plant-based fats, omega-3s, whole grains, and regular movement. It's also important to be wary of highly processed blackberry products like jams, sweetened juices, or artificially flavored snacks, which often contain added sugars that can raise triglycerides and undermine cardiovascular health. Whole, fresh, or frozen blackberries offer the full spectrum of fiber, polyphenol, and nutrients without the added drawbacks. In conclusion, blackberries provide a multi-pronged approach to managing cholesterol levels naturally. Through their soluble fiber, anthocyanins, and anti-inflammatory properties, they help reduce LDL oxidation, support HDL function, and promote overall cardiovascular balance. For those looking to take control of their heart health through food, blackberries are a simple, effective, and delicious way to start.